So today marks 328 days since our first case of COVID-19 in Albany County. Back on March 12th, hard to believe it's going to be almost 11 months. And I was talking to my deputy last night, Dan Lynch, about this, that this is right around the time we got our first phone call with the potential of cases coming this way. So it's been a long year for all of us, but we're almost there. But sadly, we had one person pass away last night to COVID-19, a woman in her 80s. So this brings people that passed away from COVID-19 in this county to 322 since the outbreak started. My condolences and prayers go out to the family, to the other 321 families. It's a difficult time to lose anyone under any circumstance. It's even harder today to say goodbye to somebody. It's gotten better. Funeral parlors are doing a great job trying to get people in safely, but again, it's hard. So as of today, we have now been about roughly 18,568 cases of coronavirus in Albany County to date. And we have an increase today of 69 positive cases since yesterday. That brings our 5-day average to 119.4. Yesterday it was 139. But I want to take a minute, and which is good. And we said this. I knew December was going to be bad. I knew January was going to be a tough month. And we knew we'd start going down. But to talk about the lower positivity numbers over the last 7 days, we also have to talk about testing sites that were shut down. So we're going to see even lower numbers and less people getting tested. So I think someone said in one of the media groups here that, yeah, we need more people to go out and get tested, please, because it messes with our percent positive numbers, because if less people are getting tested and there's more positives out of that, it throws our 7-day rolling average out the window. So, just to give you an idea, February 1st, it was 6.8. Today it's 5.3, but we're having more percent higher numbers because less people are tested, more positive. So we do need people. Just go out and get tested. We want you to get tested. One, we want to know if you have it, and two, it does help in the more that we can map and trace this through epi people and everything else. It helps to stop the spread. As you know, you can go to the Albany site. It's free. They don't charge you anything. Whitney Young, we pay for it if you don't have insurance. So please go out and get tested. There are currently 2,400 people under mandatory quarantine. Yesterday there was 2,482. Of the positive cases, 13 had close contact with a positive person. 6 are healthcare workers. 50 don't have a clear source of infection at this time. And we've had 55,942 people who have completed quarantine, 17,322 that were positive with COVID-19 and had recovered. So yes, we do have the recoveries, and that's a good thing. Unfortunately, we've had 6 new hospitalizations overnight. There are 130 people currently in the hospital hospitalized with the virus. Yesterday was 146. There are 16 patients currently in the ICU. Yesterday it was 15. I will say to you again, please wear your mask, cough into your arm, socially distance, clean your hands, and we'll get through it. We're getting there. We're getting there, and we'll continue to get through it by working together. So please, those who want to get the vaccine, you can call 1-833-697-4829. And also, we made it simple with United Way, and to United Way's leadership, thank you, the 211. Not only can you call to find out about appointments, how you can get through it, but you can also, they'll help you navigate the website and help you do taxes. So a lot's going on with the 211. But again, it's about giving customer services, making it easy for the people that can't navigate the internet and have issues with that, and making sure you qualify to get the vaccine. I know we're going to talk a little bit about that when Dr. Whaling gets here. They opened up more categories into this, and we're still trying to finish off the 1As and the 1Bs. So there's still a lot of people to get through, and there's still a lot of, unfortunately, seniors over 75 and 65 that have not got the vaccine yet. So, and they're the ones, unfortunately, that are being affected the most with the COVID-19. So obviously, Dr. Whalen's running a little behind. She's on a Zoom meeting, but I got Javon here, the Director of Operations, to talk about Mohawk. We were here a couple weeks ago with the partnership we talked about with Albany County and Mayor Sheen and the City of Albany and Mohawk Ambulance, and about people that are at home that can't get out, because I will assure you there's a lot of seniors that have not gone out, people with underlying health issues that have not gone out into the community, that have been home for almost a year, which is sad. They're afraid to leave their house. They just want to get the shot, or they just don't have transportation, or don't want to get on a bus, or don't want to take an Uber or Lyft or get in someone's car because they're afraid of getting COVID-19. But what better way than to partner with an ambulance services that's been around as long as Mohawk Ambulance has. And it's just not Albany based. I know we kind of get in that little bubble. This is their capital district. They're based out of Schenectady County, and they do so much for the community, and day in and day out. I was joking around with them the last time that I did work for Mohawk early on when I was a firefighter, and just A, to get more EMS experience, and B, they're a great organization. And they were talking about their mobile trailers that they need to get on board, and I'll let Javon talk more about it. But it's impressive, the money they invested in this, and these trailers, I believe, can hold up to 8,000 vaccines. Correct. 4,000 in each section of it, but 8,000 total, which is huge, because now we're coming to you. And that's been a goal of ours since this has started, is to get the vaccines to the people. We have a population of over 55,000 seniors over the age of 65. We have ones that are on different programs throughout the county that get checked on for health care checks but can't get out, or Meals on Wheels, which we've done a lot of work and data together. We worked with Albany Housing, the City of Albany, Mayor Sheen's team, and the mayor to put a extensive list together of people that aren't able to get out in housing in these communities where this is affecting them the most. So I do want to thank everyone, because it takes a partnership. It's not about Mohawk standing out, or Dr. Whalen does, and your team does a good job, but bad example with the doctor right now. But it's not. It's about the partnerships, but it's about working together and getting things done. And this relationship that we forged, and I'm hoping the governor signs off on the Department of Health, and the governor's done visionary things throughout the state to get pods up and other ways through churches to get stuff done. Again, I'm hoping that we get the green light. But Javon.
Thank you, County Executive, and thank you for having us here. Just an update on our program. We are ready to go. All of our equipment is in place. I'm glad to say, through the partnership through Albany County, as well as working with the state, we should be receiving our first allocation today, which will be on the road tomorrow, initiating our mobile vaccine program. Primarily, this first batch of vaccines, through the partnership of Albany County and City of Albany, we're going to be focusing on Albany County, Albany City Housing Authority, getting to the low-income population that does not have the ability to travel, that are kind of stuck in their homes at the current moment. We're utilizing all of those lists that the county executive has mentioned. So again, we should be receiving our vaccines today, with a deployment starting tomorrow morning. We have all of the equipment in place. We can house Pfizer vaccines, Moderna vaccines, ultra cold freezers, standard freezers, refrigerators. The trailer has portable freezers. Mohawk Ambulance has invested probably around $100,000 into this program at this point. And we're looking forward to continuing the program and expanding it as we can get our hands on more vaccines as time comes. We've hired on additional staff. We're utilizing EMTs and paramedics already on staff. We've also hired on an additional 50, with another 25 to 50 in the queue. Hopefully we can open up more pop-up clinics and execute all of these programs. But thank you again for having us. We're looking forward to really forging this private-public partnership, and looking forward to really getting this done. And like the county executive said, we're going to get it done. That's about it.
Thank you, Javon. And again, we're hoping the governor gives the green light. Again, with all his great initiatives he's doing across the state with the pods and other areas. And, this is just another tool in the arsenal to get the job done. And trust me, as I sit here, someone asked me why I'm trying so hard, and it's just not for every resident that's home that can't get out. But I know, having a sister-in-law that has ALS, that can't move, that talks through a machine, who's only 49 years old and been living this, unfortunately, for a long time. Can't get her the vaccine shot, and it's nearly impossible to get her out, and she doesn't fall in that category. She's falls because she's 48 years old, and and she needs it more than anyone else. And so a lot of it is driven by my passion for my sister-in-law and for people like her, not just with her, not just people with ALS, but all the people that are home, and the seniors, especially the seniors that are home. Again, doing the right thing and trying to get through this. And talking about the right thing, and Dr. Whelan, her team, the pod that they just went through, the Times Union Center, again, to Bob Belber and ANS, and to their staff, and to everyone down there, and the Albany PD for doing the security out front, and the partnership with Mayor Sheen, but with the health department. And I got so many kudos. I'm like, well, I'll send it to Dr. Whelan. And people just, the experience they had walking through there, in and out, people are like, we were, watching social media, we were in and out in 20 minutes. And to go through 800 people, and I think he did 402, less than 2 hours, if I stand corrected.
800.
Oh, 800. Yeah. So it's been an incredible operation. We are lobbying for more vaccine. We've been working with the different pharmacists. I do want to say to Assemblyman John McDonald, thank you for being a great partner. And the communication, not just from John's office, but from John himself, Pat Fahey, but the Lincoln Pharmacy and in Price Chopper and Market 32, and to everyone involved with it, because you need that communications. And that was a little rough in the beginning. It's getting better. It's not perfect, but really just coordinating the groups of people we need to get to. But Dr. Whelan, please.
Good morning, everybody. So this is great to hear about the various partnerships that are occurring in the county and across the state for the vaccine rollout. And as has been indicated, this isn't something that one entity can do. So these partnerships are important. It is essential that we continue to look at innovative means to get vaccine, particularly into the arms of the underserved population who may find it difficult to schedule online or present to a larger vaccine clinic. So I'm so happy to hear about all of these initiatives and know that every day we're getting closer to herd immunity, which is what our end game is. If we continue to get supply, if supply continues to be augmented, this could be something that we achieve as a nation as early as the summer. And it is something that requires the effort of everybody that's listening. Because you need to do two things. You need to, first of all, ensure that you're continuing to wear your mask and stay socially distant and avoid large gatherings. And you need to, plan for a vaccine if you are eligible for a vaccine and as you are eligible for a vaccine. We have heard many questions and concerns from our seniors, and I certainly understand that it is difficult, that there is not enough availability at this point. But I urge everyone to continue to be patient. We got some good news on the national front last night, hearing that retail pharmacies, larger retail pharmacies, chain pharmacies, will be given a supply of vaccination starting next week. I don't have individual knowledge of whether those pharmacies will be in our area or not, but I do see this as a good sign. And if our pharmacies next week, the chain pharmacies, do not have availability, that they may have availability in the near future. Unfortunately, as I have stated many times, we are mandated to vaccinate within the population that has been identified for us to vaccinate, and these are the 1B essential workers. So they are very important workers in our day-to-day life, and include police and fire and teachers and grocery store workers. And this week we got an allotment for OPWDD facilities. So tomorrow we will be giving overall 1,400 vaccinations. 1,000 of them will be first dose, 400 of them will be second dose. Of the first dose vaccinations, 200 are allocated for OPWDD, and the 800 other first dose are allocated for 1B essential workers. So we really look forward to playing our part, to continuing to do this in the way that we have trained to do. Our clinic tomorrow will vaccinate 1,400 people in total with first and second doses, and it's planned from 1 to 7:30. So we have had tremendous help from our Medical Reserve Corps in organizing this, in staffing this. Those that have come have learned their roles. We have many medical professionals that are doing vaccination and others that are assisting with the needed input of computer data, et cetera. We have medical staff on site, and it is a well-run machine. We released our link last night at 5 o'clock, and the clinic was filled in a very short period of time. So as allocations continue, we look forward to continuing this weekly effort. We also are continuing to work very carefully with our, and on a daily basis, with the Vaccine Hub at Albany Medical Center. And this week there's a lot of information every week, but there are challenges. The hospitals and many of our pharmacies did not receive allocations this week, and we're hoping that is changed, because it is concerning that there are still 1A essential workers out there that are not yet vaccinated. We in our pod don't have the ability to vaccinate those people, and the supply is needed to be able to ensure that all essential workers who are frontline health workers are vaccinated. And we know similarly we are really interested in getting additional vaccine for our seniors. It's been a tough time for everyone. Everyone has spent many, many months indoors. Even if you're going to work every day, it has affected your life in many ways. And we all want to get past this. So it's important that we all continue to work very closely together on these strategies to get vaccine out. And we look forward to continuing to do so. I will say, in terms of good news, we have noticed the continued downward trend in the number of cases that we're seeing. We are definitely off of the holiday surge, and I'll go so far today as to say it's encouraging. So as we start to see the numbers decrease, we can not lose vigilance, because we know we still have concerns. But we can start to get more positive thoughts to get us over the finish line of this. So we continue to work at the health department doing case investigations and ensuring that we are implementing control strategies that have been important and essential to us since the beginning, including isolation and quarantine. So if you are contacted by the county health department or by the state health department, to be informed that you're either placed on isolation because you've tested positive, or you're placed on quarantine. Those strategies remain essential to stopping the spread. We still have to get those messages out that if you have been directly in close contact with someone with COVID, you can manifest symptoms up to 10 to 14 days after you're exposed. So it is essential that you quarantine for those 10 days and monitor your symptoms. And if you're not feeling well on day 10, you don't come off quarantine until you're tested and negative. These are essential to continuing our downward trend of numbers. So again, I think it's important to discuss those strategies.
Thank you, Dr. Whelan. Thank you to the whole Department of Health and everyone that's been helping out. So I do want to take a moment and talk about my favorite subject, sports guidance. So my office has been getting a lot of calls from not just superintendents, from parents, happy with the decision that Dr. Whelan made and her team, based on science, not based on feelings. So, but we did say practice and conditioning and weightlifting and social distance drills are permitted. So hopefully the coaches that didn't read it have read it and understand it now. And we need to get that rolling average down to 4%, which we, like Dr. Whelan said, we're getting there. So we're hoping that we're going to get there. And, again, if you look at Sienna's women's basketball was put on pause, Albany, bringing this outbreak in Averill Park. So you're seeing some of the sports that have come back, unfortunately, now have to take a break after the first couple of days it came back for outbreak of COVID-19. So we're encouraged to continue to reach out to the schools. Still waiting for the school guidance to get back to us because there's a lot of steps that they have to take to move forward, and working with them in a partnership to get through it, because working together we'll get through this. And and I appreciate everyone doing the right thing. Again, it's a marathon, not a sprint. We said this since the beginning, and we're all in this together, regardless of how you feel about it. Whether you believe in wearing a mask, whether you believe in you should just go out and live life, just be courteous to the people around you. That's it. That's all I can say. Please, if you need to get tested, go to Whitney Young. The appointment number, as always, 518-465-4771. We cover it. Albany, 188-364-3065. Free, set up, many sites across the state of New York by the governor. And again, you can go to albanycounty.com to view testing and locations in our county, as always, and wait times and all that. They are updated within 24 hours, so they sometimes lag behind. And our mental health support, which is available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Please, people, take the time, not just talk to your wife or your spouse or your lover or your friend, brother-in-law, sister-in-law, sister, whatever, who's in your life or your children. Just take the time and talk about what's going on in the world and talk about what's going on around the environment. And we can help each other get through it. A 24-hour sexual assault hotline number is always 518-447-7716. And they're available Monday through Friday, 10 a.m. to 2 and 4 to 6. To Karen Ziegler and her team, thank you for what you're doing. It's not an easy job, and I often think of your whole department because of what you're dealing with. So again, please call that number, and you can text now if you don't want to call. If you feel unsafe, if someone's around you, you can text your message, you can email your message, and we'll make sure it's addressed. Also, please call the 211 in the New York State hotline, as always, 188-364-3065. Again, I can't thank the partnerships I have forged these last 11 months. With Mohawk Ambulance, with everyone else, a variety of people, stakeholders from United Way, and I could just go on, the airport, I could just go on with a variety of things that we have done to continue to move forward with all the elected officials, Paul Mahan, Peter Barber and Gilderland, Pat Ciselli, all of them, and Mayor McNulty, Ryan in Green Island, and we've all worked for the people, and I just want to say we will get through this, but we need to continue to work at this. And remember, it's not about us. It's not about our egos. This is about us working together to make sure that we work for the people, because it's most important thing is the safety and health of everyone. So again, thank you. Stay safe out there, and wear a mask.